Hello, I'm Dr. Rhonda Johnson. Today is Thursday, February 27th, 2025. Today, I'm talking about measles, one of the most contagious viruses on earth. How does it spread? It spreads through respiratory droplets when an infected person coughs, sneezes, or breathing. These measles-infected droplets linger in the air for up to 2 hours, and they can infect anyone who enters that space. Now, once inhaled, the virus first infects the respiratory tract, your lungs, and your bronchial tubes. It replicates rapidly, and it leads to a high viral load, making transmission even easier. 90% of non-immune people exposed to measles will become infected. Now, after spreading from the respiratory tract, the lungs, and to the bloodstream, measles then gets to other organs, including the lymphatics, the gastrointestinal tract, kidneys, liver, skin, and then I'll talk about the brain. Now, a person with measles is contagious for about 9 to 10 days, especially 4 days before the rash appears and 4 days after the rash appears. Just think 4 and 4. 4 before the rash, 4 after the rash. The day the rash appears is considered day 0. Now, the 5 main symptoms of measles are runny nose, cough, red watery eyes, high fever, and a rash. On light complexion people, the rash is red. On darker skinned people, it might just look bumpy, but it typically starts on the face and goes downward and appears 3 to 5 days after the symptoms begin. Other symptoms can include sore throat and white spots in the mouth. Now, in severe cases, measles can cross what's called the blood-brain barrier and lead to life-threatening complications such as encephalitis. That's when the virus directly invades the brain tissue and causes neurological damage, disability, or even death. Now, folks, there is no antiviral treatment for measles. But you got to remember this. Measles is almost 100% preventable through vaccination with the measles, mumps, and rubella vaccine, the MMR. It is about 97% effective at preventing measles, and the MMR vaccine protects you for life, so you shouldn't need a booster shot. Now, we know measles is resurging in the United States. In West Texas, there's been an outbreak that has reached 124 cases, mostly among children ages 5 to 7. And tragically, a school-aged child has died, the first measles death in the United States since 2015. And that just breaks my heart. And my sincerest condolences to the family. Now, globally, 10.3 million people were infected with measles in 2023, and nearly 107,000 people died. In the last year in the United States, there were 285 confirmed measles cases, and 40% of those folks required hospitalization, mostly young children. Now, measles knows no borders, no state borders, no international borders. But we have to remember that measles can be prevented, but only if we take action. And that action is vaccination, which saves lives. Folks, don't wait until it's too late. Protect yourself. If you're unvaccinated, get vaccinated. Parents, protect your children. Get them vaccinated. That's my message today. Take care, folks, and be well.